Inspect the patient's hands for cyanosis and the fingers for clubbing.
May I ask
Instruct
you
the
to open
patient
and
to
close
open
your
and close
hand,
his
please?
hand and make a tight fist. Then, compress the radial and
make a
ulnar
tight
arteries. Then ask the patient to open his hand. You will see
Please
that the
open
palm
your hand.
is pale, then release the ulnar artery. Ask the patient
Tight
to make
fist
a
again.
tight fist again. When he opens his hand,
Open your
release
hand.
the radial artery. Notice the time when the palm returns to its normal color.
Now let me check your brain pulse.
Flex the patient's elbow slightly and palpate the artery just medial to the biceps tendon at the antecubital crease. In assessing for the jugular venous pressure, the starting position for the head of the bed
Please
is
tilt
30
your
degrees.
head a little to the left.
Turn the patient's head slightly away from the side you are inspecting. Use tangential lighting and examine both sides of the neck.
This time, to the other
Identify
side.
the external jugular vein on each side, then find the internal jugular venous pulsations. Focus on the
This
right
time,
internal
I'll measure
jugular
your
vein.
jugular venous pulse.
Identify the highest point of pulsation in the right jugular vein. Extend a long rectangular object or card horizontally from this point and a centimeter ruler vertically from the sternal angle, making an exact right angle. Measure the vertical distance in centimeters above the sternal angle where the horizontal object crosses the ruler and add to this distance 5 centimeters. The sum is the jugular venous pressure.
Now let me inspect your anterior chest.
Careful inspection of the anterior chest may reveal the location of the apical impulse or point of maximal impulse. To palpate heaves and lifts, use your palm or hold your finger pads flat or obliquely against the chest. For thrills, press the ball of your hand firmly on the chest to check for a buzzing or vibratory sensation caused by underlying turbulent flow. Identify the point of maximal impulse at the left ventricular area with the patient's spine.
Sir Brody, inhale and exhale slowly for me, please.
Listen to the heart with the diaphragm of the stethoscope first, then with the bell at each of the 6 auscultatory areas, starting at the apex and moving to the base. Move the stethoscope from the point of maximal impulse medially to the left sternal border, superiorly to the second interspace, then across the sternum to the second interspace at the right sternal border.
Sir, I'm gonna check your popliteal pulse. Please, flex this a little.
In palpating the popliteal pulse, the patient's knee should be somewhat flexed with the leg relaxed.
Alright.
Place the fingertips of both hands so that they just meet in the midline behind the knee and press them deeply into the popliteal fossa.
I will check your dorsalis pedis.
Palpate the dorsum of the foot just lateral to the extensor tendon of the great toe. If you can't feel a pulse, explore the dorsum
Then
of the
lastly,
foot more
sir, I'll
laterally.
check your posterior tibial pulse.
In palpating the posterior tibial pulse, curve your fingers behind and slightly below the medial malleolus of the ankle. This pulse may be hard to feel in a fat or edematous ankle. The following findings suggest normal result of the cardiovascular system physical examination of the patient. Jugular venous pressure is 2.5 above the sternal angle. BMI is at the right location. Normal heart sounds. Extremities are warm, no edema. Finally, all peripheral pulses are 2+ and symmetric.